Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear an optometrist talking to a patient named Mr. Stevens. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mr. Stevens. Good to see you today. How can I help you?
Hi, Doctor. I think I may have the flu. I've been feeling awful for a few days now.
I'm sorry to hear that. Let's go through what you've been experiencing to get a better picture. Could you describe your symptoms in detail?
Sure. It started with some chills and muscle aches a few days ago. Then I developed a fever, and I've been coughing and feeling very tired since then. It's really wiped me out.
Sounds like you're dealing with quite a bit. Are you experiencing any other symptoms, like a sore throat, nasal congestion or headaches?
Yes, actually. My throat is sore and I feel congested. My head hurts on and off too. Breathing feels a little strained, especially with the coughing.
It sounds like you may have influenza, or the flu, as you suspected. This is a respiratory illness caused by the influenza virus and is quite common this time of year. Have you had any known exposure to anyone sick with similar symptoms?
Yes, my coworker was out sick last week, and I suspect it might have started with him. But I wasn't too worried because I felt fine then.
It's very possible, as influenza can spread quickly in close contact settings like workplaces. The symptoms you're describing are quite typical: body aches, fever, fatigue, cough and congestion. Are you currently taking any medication to help with your symptoms?
Just over-the-counter stuff. Ibuprofen for the fever and body aches, and some cough syrup. I haven't seen any big improvement yet, though.
That's good to hear. Over-the-counter medications can be helpful in managing symptoms. Typically, influenza will run its course within a week or 2. However, it can be intense and quite uncomfortable during that time, as you're experiencing. Do you happen to have any underlying health issues like asthma or diabetes?
No, I'm usually pretty healthy. I just haven't felt this bad in years.
That's good to know. Healthy individuals usually recover without complications, though the flu can certainly feel miserable. There are antiviral medications available that can shorten the duration of symptoms if taken early on, usually within the first 48 hours of symptom onset. Given where you are in the course, though, these may not be as effective now.
So, it's probably too late for that? Anything else I can do to speed up recovery?
At this stage, the best approach is supportive care. Continue with ibuprofen for the fever and aches, and keep taking the cough syrup if it's helping. I also recommend drinking plenty of fluids, water, tea, clear soups, anything to keep hydrated. Rest is essential as well, as your body needs energy to fight off the virus.
I've been trying to stay in bed as much as possible, but it's hard when I feel so uncomfortable.
That's understandable. It can help to take small, frequent breaks, especially to stretch or walk around a bit if you're able to. For congestion, a humidifier or hot shower can sometimes relieve nasal blockage. And if the sore throat is bothering you, gargling with warm salt water a few times a day can provide relief.
Good to know. What about being around others? My partner is worried about catching it from me.
That's a valid concern. Influenza is contagious, primarily spread through respiratory droplets from coughing or sneezing. To protect those around you, it's best to isolate as much as possible until you're fever-free for at least 24 hours without medication. Wearing a mask when near others and practicing good hand hygiene will also help.
Got it. I'll do my best to keep some distance then.
Great. Another preventive measure is cleaning commonly touched surfaces, like doorknobs, handles, and remote controls, especially if others in your household are healthy. Using a disinfectant can reduce the chances of passing it on.
I didn't think of that. I'll get on it.
Excellent. Also, I'd like to encourage you to consider getting the flu vaccine in the future, especially during flu season. While it doesn't guarantee immunity, it does significantly reduce the risk of contracting the virus and can lessen the severity if you do catch it.
I didn't get it this year, but maybe I will next time.
Sounds like a good plan. Vaccination is particularly important for those around young children, elderly family members, or anyone with a chronic illness, as it protects both you and them.
I'll keep that in mind. So, for now, just keep taking it easy, stay hydrated, and wait it out?
Yes, exactly. And if you notice any worsening symptoms, difficulty breathing, chest pain, or severe dehydration, please don't hesitate to seek immediate care. These could indicate complications that require medical intervention.
Thanks, Doctor. I'll watch out for those.
You're welcome, Mr. Stevens. Rest up, and don't hesitate to reach out if you have any concerns as you recover. Take care.
Extract 2, questions 13 to 24. You hear a GP talking to a patient called Mrs. Hayes. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mrs. Hayes. It's nice to see you. I understand you've been experiencing some vision issues lately.
Yes, Doctor. It's been a bit worrying, to be honest. Everything seems hazy and dim, especially when I'm out in bright sunlight. I also struggle to drive at night because the headlights from other cars are just so glaring.
That sounds challenging, Mrs. Hayes. Vision changes like these can feel disorienting. Based on what you've described, I'd like to talk with you about the possibility of cataracts. Have you heard of them before?
I have, actually. My mother had cataracts when she was around my age, and I remember she had to have surgery. Is that what's happening to me?
It's very possible. Cataracts are common, especially as we get older. They occur when the lens in your eye becomes cloudy, causing blurred vision and making bright lights, like sunshine or headlights, harder to tolerate. Symptoms like haziness, light sensitivity, and difficulty with nighttime driving can all point to cataracts.
I see. I've noticed that I even need more light just to read at home these days, and I've also had to change my glasses a few times over the last year, but nothing seems to help for long.
Yes, those are classic signs. When cataracts progress, they can affect your ability to see colors vividly, make reading difficult, and sometimes cause double vision in one eye. Even the best glasses can't fully correct vision that's clouded by a cataract.
That explains a lot. So what causes them, Doctor? I don't smoke or drink, and I try to eat a balanced diet.
It sounds like you're doing all the right things, Mrs. Hayes. While age is the main factor, there are other causes too. For some people, cataracts can develop due to prolonged UV exposure, certain medications, or even health conditions like diabetes. Genetics can play a role as well, so if your mother had them, that may increase your likelihood.
Oh, I didn't realize there were so many factors. Is there anything I can do to slow them down?
Protecting your eyes from UV light by wearing sunglasses outdoors is helpful. And a diet rich in antioxidants may contribute to eye health. However, once cataracts form, they can't be reversed. But the good news is that they are treatable with surgery.
Surgery? I was hoping you wouldn't say that. What does cataract surgery involve?
It's quite a straightforward and commonly performed procedure. During surgery, the cloudy lens is removed and replaced with an artificial one. Most people notice a significant improvement in their vision shortly afterward. It's usually done on an outpatient basis, meaning you can go home the same day.
That's reassuring. How long does it take to recover? And is it painful?
Recovery tends to be quick. Most people can resume normal activities within a week or so. Some minor discomfort is normal, but it's usually mild and can be managed with eye drops. Your vision may be a little blurry at first, but it gradually improves. Most patients find the procedure tolerable and well worth the result.
That's good to hear. If I do need surgery, would it restore my vision completely?
In most cases, yes. Cataract surgery has a high success rate, and many people experience a dramatic improvement. However, some may still need glasses for reading or distance vision. The new lens can also be tailored to correct certain vision issues you may have had prior, which can further enhance your sight.
So, how would I know if I need the surgery now?
We'll arrange for an ophthalmologist to examine your eyes in detail. They'll assess the extent of the cataract and discuss with you if it's affecting your quality of life enough to consider surgery. Some people manage well without it for a while, but if you're struggling with daily tasks, it might be time to proceed.
That makes sense. I've just been putting up with it, but it's getting harder to manage. I suppose it's time to address it.
It sounds like you're making a wise decision, Mrs. Hayes. Let's get you referred to a specialist. They'll provide a thorough examination and explain the next steps so you're fully informed.
Thank you, Doctor. I feel a lot better now that I understand what's happening and what can be done.
You're very welcome, Mrs. Hayes. I'm glad we could have this conversation. Taking proactive steps with your vision will help maintain your quality of life. Don't hesitate to reach out if you have more questions.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a senior researcher providing guidance to a junior researcher. Now read the question.
There are some fascinating areas to explore, aren't there? But you took some time to decide which topic you wanted to focus on. So, what does that suggest about preparing for this kind of research?
I guess I need to review current research trends in advance.
Exactly. And of course, with fields like telemedicine and AI evolving so quickly, you need to know how recent the studies are before you dive in. It'd be nice if there were more centralized resources for this.
Should I look into just one of these areas, or try to compare several?
Either approach is fine as long as it's thorough.
Now look at question 26. You hear a medical professional explaining effects of climate change. Now read the question.
Loss are severely affecting various species, particularly those with specific environmental needs. Some animals are forced to migrate or adapt to new habitats, which can lead to increased stress and vulnerability to disease. One prominent case is coral reefs, where warming seas have caused widespread coral bleaching, devastating marine ecosystems and the species that rely on them. In addition, changes in weather patterns are expanding the range of disease-carrying insects, exposing animals in previously unaffected regions to new health threats. This trend is particularly concerning for species already at risk due to limited habitat.
Researchers continue to study species and ecosystems that are most vulnerable to these climate-induced health issues to better understand and address the challenges they face.
Now look at question 27. You hear a nurse talking to another nurse about the discharge of a patient. Now read the question. Kevin, can I speak to you for a moment?
Sure, what's on your mind?
I noticed you seem to be a bit distant with the patient in room 12, the one recovering from substance abuse. He's due to be discharged soon, and I think he could really benefit from some counseling before he leaves. But it looks like it's challenging for you to connect with him.
I know, but honestly, I feel like he brought this on himself. It's hard for me to sympathize with someone who made so many harmful choices.
Remember, we are here to support our patients in recovery, not to judge them. People dealing with substance abuse deserve compassion, not blame. Think about how you would want a loved one in his situation to be treated with understanding rather than stigma. Now look at question 28. You hear a doctor briefing about a patient. Now read the question.
Alright, we have a patient who was admitted last night after arriving at the A&E with symptoms of persistent nausea, vomiting, and altered consciousness. Initial assessment suggested dehydration, rapid breathing, and a fruity odor on the breath, which raised concerns for diabetic ketoacidosis, or DKA. Lab tests so far show a significantly elevated blood glucose level, high ketones in the blood and urine, and an acidic pH on arterial blood gas analysis, all pointing towards a diagnosis of DKA. However, additional tests are needed, including electrolyte levels and renal function tests, to further assess the severity and guide treatment adjustments.
Now look at question 29. You hear a patient talking to a dental receptionist about teeth whitening. Now, read the question.
Hi, I wanted to ask about teeth whitening options. I'm hoping to make an appointment to discuss it.
Of course. Have you had any whitening treatments with us before?
No, but I'm interested in finding a method that won't harm my enamel. I've read about a few options, but want to be sure I'm not choosing something too harsh.
I understand. Some of the treatments we offer use gentle formulas specifically to protect enamel. Are you considering in-office treatments, or are you open to take home kits?
I'd prefer an in-office treatment, just to be safe. But I've heard that some methods can make teeth more sensitive, and I'd rather avoid that.
Well, Dr. Patel specializes in enamel-safe whitening. He could go over all your options and suggest the gentlest approach.
That sounds great. Do you have an available slot with Dr. Patel soon?
Yes. We can fit you in this Friday afternoon.
Perfect. Thanks. I'll see you then.
Now look at question 30. You hear a junior therapist asking his senior colleague about using aromatherapy for a patient with anxiety. Now, read the question.
Scheduled for any aromatherapy sessions this week, but I wasn't sure if I should ask about it because she looked quite distressed this morning. Is it because her anxiety symptoms have worsened?
Well, sometimes we delay aromatherapy if a patient has heightened symptoms, but that's not the case here. Ms. Williams was actually started on aromatherapy sessions last week, but she mentioned this morning that it made her feel dizzy and lightheaded. Until we've assessed the reason for that, It could be a reaction to the specific oils. For example, we're supporting her anxiety management with breathing exercises and guided meditation instead.
Oh, I see.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear an interview about the role of speech and language therapists in neurological rehabilitation. You now have 90 seconds to read questions.
Today I'm speaking with Sarah Dalton, a certified speech and language therapist who works primarily in neurological rehabilitation. Welcome, Sarah.
Thank you for having me. I'm excited to share more about how speech and language therapy can support patients on their journey toward recovery. Many people may not realize the full scope of our profession and how crucial it can be, especially after significant neurological events.
Let's start with an overview of your role. How would you describe the work you do in neurological rehabilitation?
My role involves assessing and treating patients who've experienced neurological impairments, such as stroke, traumatic brain injury, or progressive diseases like Parkinson's. I work with patients on issues related to communication and swallowing, aiming to help them regain independence in these vital areas. In many cases, patients experience both physical and cognitive difficulties, and our work can significantly impact their quality of life. Traditionally, this role might have been less understood, but it's now widely recognized as integral to rehabilitation.
So, what has led to this shift in perception about the role of speech and language therapists?
A large part of it stems from research highlighting the role of communication in patient outcomes. Patients' ability to communicate can directly affect their recovery process and mental health. As a result, there's now a much stronger emphasis on having speech and language therapists as part of multidisciplinary care teams. In the NHS, this focus has grown over the years, recognizing that better outcomes aren't just physical. They include emotional and social aspects, which our profession addresses.
I see. Could you tell us more about the types of therapies you provide in your practice?
Absolutely. We offer therapies that address various needs. For instance, after a stroke, some patients may have aphasia, a condition affecting language processing. So we use structured language exercises to help them regain communication skills. Others may have dysphagia, which impacts swallowing, so we work on exercises and strategies to improve their ability to swallow safely. Each therapy plan is tailored to the individual, and it often involves family members so that patients can practice techniques in their everyday lives.
That sounds quite comprehensive.
Is there a case that comes to mind where your role made a significant difference?
Yes, actually. A recent case involved a young patient who suffered a traumatic brain injury from an accident. He had both cognitive communication issues and dysphagia. By working closely with his family and the wider healthcare team, we designed a therapy plan to gradually improve his speech, comprehension, and swallowing. Over time, he regained enough communication ability to re-enter social settings and felt more like himself again. His story is a testament to how speech and language therapy can be transformative.
That's wonderful. It sounds like your role is expanding. Is this development being formally recognized?
Yes, the field has introduced frameworks to support our expanding role. For example, in the UK, speech and language therapists are encouraged to develop along 4 key pillars: advanced practice, research, leadership, and education. The first pillar, advanced practice, involves staying updated on therapy techniques and managing complex cases. Research and evidence-based practice are essential too, as we need solid evidence to guide our approaches.
It's interesting that leadership and education are included. How do those apply to speech and language therapists?
Well, as part of a multidisciplinary team, we're often required to advocate for patients and lead discussions about their care, hence the leadership pillar. Education is equally vital, both in terms of educating ourselves to keep our knowledge current and educating other team members about how communication affects recovery. We also teach patients and families about therapy techniques so they can continue the work outside the clinic.
It's great to hear that such a clear framework exists. Are there any challenges that limit the reach of speech and language therapy?
The main issue is a shortage of resources. While there's recognition of our value in neurological rehabilitation, funding remains inconsistent. Many patients who could benefit from frequent therapy sessions may only receive limited support due to budget constraints. If we could secure more stable funding, we could offer more comprehensive therapy, especially for complex cases that require intensive intervention.
Thank you, Sarah. It's been enlightening to learn about the scope of speech and language therapy in neurological rehabilitation.
Extract 2. Questions 37 to 42. You hear a detailed presentation on preventive health screenings for older adults. Now, read the questions. You now have 90 seconds to read questions. Hello everyone, and thank you for joining this session on preventive health screenings for older adults. As healthcare professionals, we recognize that preventive care becomes increasingly essential as people age. In this presentation, I'll be highlighting the types of preventive screenings that are critical for older adults, the health conditions these screenings aim to detect early, and the lifestyle changes that can help improve health outcomes in this age group. To begin, let's discuss why preventive screenings are so crucial for older adults. Many conditions, such as cancer, cardiovascular disease, and diabetes, often progress silently in their early stages, meaning they can go unnoticed without regular screening. However,
Catching these diseases early gives healthcare providers more treatment options and a better chance of slowing or managing the progression. Let's start with cancer screenings. Cancer risk naturally increases with age, and certain cancers such as breast, colorectal, and prostate cancer are more common in older adults. Screening recommendations vary depending on factors such as family history, lifestyle, and previous medical history. For instance, mammograms are generally recommended for women every 2 years up to age 74, while men might be advised to have prostate-specific antigen PSA tests depending on their risk factors. Colorectal cancer screenings, which can include colonoscopies or stool tests, are also a high priority and can be done at intervals depending on previous test results. Now, let's look at cardiovascular screenings. Heart disease remains a leading cause of death among older adults, so regular blood pressure and cholesterol checks are critical. For example, high blood pressure often has no obvious symptoms, yet it significantly increases the risk of heart attack or stroke. Screenings for high blood pressure, cholesterol, and diabetes can help detect these risk factors early, enabling preventive interventions. For diabetes, a common method is the HbA1c test, which provides a long-term picture of blood sugar levels and can help in both diagnosing diabetes and managing it if already present. In addition to these screenings, immunizations also play a vital role in preventive care for older adults. As the immune system weakens with age, older adults become more susceptible to certain infections. For instance, annual flu shots are recommended, as are vaccinations against pneumonia and shingles, which can have serious complications in older adults. A yearly flu shot is generally advised, while the pneumococcal vaccine is often recommended once after age. The shingles vaccine is particularly important, as shingles can cause prolonged pain and other issues that can greatly impact quality of life. Now, beyond specific screenings, lifestyle changes are also integral to preventive health. For older adults, remaining physically active and maintaining a balanced diet can reduce risks of many health conditions, including heart disease, diabetes, and even certain cancers. It's also beneficial for mobility and balance, which reduces the likelihood of falls, a common issue in older adults. The recommendations include regular physical activities such as walking, light resistance exercises, and stretching. Nutritionally, older adults may need to focus on maintaining adequate levels of protein, fiber, and essential vitamins like D and B12. Our research involved interviews with primary care physicians to understand their views on preventive health screenings for older adults. The physicians highlighted barriers and emphasized the importance of regular follow-ups. A common barrier noted was the challenge in balancing these screenings with the limited appointment times that are often focused on immediate health concerns. Physicians also emphasized that many older patients were hesitant about certain screenings due to fear or lack of understanding, underscoring the importance of effective communication. Another challenge was the complexity of coordinating screenings for patients with multiple health issues. For example, a patient with both heart disease and diabetes might require more frequent and targeted screenings. As one physician shared, balancing preventive screenings with the management of chronic conditions is a challenging aspect of care in this age group. With the right planning and patient education, however, we can often identify conditions earlier and help patients make proactive choices. In summary, preventive health screenings are essential for older adults, but require a personalized approach to address individual risk factors and health conditions. Equally important are immunizations and lifestyle modifications, which play significant roles in maintaining health and reducing risk of complications. Addressing barriers such as appointment time constraints, patient reluctance, and complexity of care coordination are key to improving screening rates and health outcomes among older adults.
That is the end of Part C. You now have 2 minutes to check your answers.